How does adaptive DBS address freezing of gait? Freezing of gait is a challenging symptom for many people with Parkinson's disease. It involves sudden, brief episodes where a person struggles to start or continue walking. This can be frustrating and even dangerous. One innovative approach to help manage this symptom is adaptive deep brain stimulation. Unlike traditional deep brain stimulation, which delivers constant stimulation, adaptive deep brain stimulation adjusts in real time based on the brain's activity. This means it can respond to the specific needs of the individual as their symptoms fluctuate. Adaptive deep brain stimulation uses sensors to monitor brain activity, particularly the neural signals related to movement control. When the system detects patterns that suggest a freezing episode might occur, it automatically adjusts the stimulation. This real-time response aims to counteract the dysfunction that leads to freezing of gait. By intervening precisely when needed, adaptive deep brain stimulation can potentially reduce the severity of these episodes. However, there are challenges in effectively using adaptive deep brain stimulation for freezing of gait. One major hurdle is the difficulty in identifying reliable neural biomarkers that predict freezing episodes. Freezing of gait can vary widely from person to person and is influenced by cognitive and emotional factors. Researchers are actively studying these neurophysiological signals to improve the responsiveness of adaptive deep brain stimulation. Personalization is another key aspect of adaptive deep brain stimulation. Since freezing of gait can present differently in each individual, the stimulation settings can be tailored to match each patient's unique neural patterns. Clinical trials are currently exploring how these personalized settings compare to standard continuous stimulation in reducing freezing episodes and improving walking parameters, such as step length and symmetry. Adaptive deep brain stimulation also aims to avoid overstimulation of brain regions involved in movement. Overstimulation can lead to further complications in gait control. By adjusting the stimulation intensity based on real-time needs, adaptive deep brain stimulation seeks to maintain effective symptom control while minimizing potential side effects. Ongoing clinical research is crucial to evaluate the effectiveness of adaptive deep brain stimulation, specifically for freezing of gait. These studies involve implanting sensors to detect brain activity related to movement and comparing the adaptive approach to traditional continuous stimulation. Early findings show promise but also highlight the technical challenges that need to be addressed. In summary, adaptive deep brain stimulation offers a dynamic approach to managing freezing of gait by detecting neural signals and adjusting stimulation accordingly. This method aims for more precise and individualized therapy, which could enhance mobility and quality of life for those living with Parkinson's disease. However, the complexity of freezing of gait and the need for reliable biomarkers present significant challenges that researchers are working hard to overcome. Always consult with healthcare professionals for personalized advice and treatment options.